Okay, so we have Thomas moderating, so he's going to help us out, and he's recording this, and you all should get a recording at the end of this presentation or later this week. So I will be speaking today. My name is Vanessa. I'm a staff attorney here at the Tennessee Justice Center. And I have a feeling that most of you all know who we are, but for those who don't know, our organization, the Tennessee Justice Center, is a nonprofit legal services and advocacy organization. And we primarily focus on access to public benefits like the Medicaid program. And so in our state, that's TennCare, and the Supplemental Nutrition Assistance Program, which is a program that provides assistance to pay for food. And we try to improve access to these programs and make these programs stronger through things like advocacy with legislative changes on the state and federal level. And we also provide direct client representation and assist folks who are having difficulty navigating these programs. And the things that we learn from our clients, from our partners, from community members, inform us on ways to advocate to make these programs stronger. One of the tools that we also look at is litigation. And so class action litigation to correct the systemic issues is something that we also consider as one of our tools in our tool belt. And we'll talk a little bit about some of the one of the cases that we're working on right now. So today, we're going to focus on the redetermination and reasonable accommodation. So this is hopefully, well, not hopefully, but this is potentially our fifth and final session in this Call to Collaborate series that we've been hosting. And just a review of our past sessions, our first session, which a lot of you were on, and thank you so much for coming on with us, was our Call to Collaborate session, where we just brought all of our partners together and we talked about the importance of everyone working together and kind of keeping each other in mind as resources to assist folks in moving through the unwinding period. And our second session was more of an advanced training for advocates who were familiar with the program and talked a little bit about eligibility and how to identify folks who should maintain their coverage during this process. Our third session was a more general discussion about eligibility, but really focused on how important it is for advocates and for folks to conduct outreach and spread the word to Medicaid enrollees to keep their health insurance through this process. And of course, to refer folks to TJC if they need hands-on help. And that's kind of been a running theme. Always consider us a resource for the folks that you're working with or for your organization. There might be ways that we can alleviate some burden or come up with creative ways to make sure that as many folks as possible maintain their coverage during this time. Our fourth session was a more practical training on how to complete the renewal. And so this we focus primarily on the TennCare Connect online portal, which is a tool that our organization actually uses to assist clients with completing the renewal, updating information with TennCare, just keeping track of the status of their application or their appeal if they filed an appeal, or we've helped them file an appeal. And then today we're going to focus specifically on how to navigate the process for individuals with disabilities who may need reasonable accommodation. And you can access all of these trainings on our training hub. It's just a online portal, which you can have a login and where we post all of our trainings, free and paid. So please feel free to join and you can have access to a number of our trainings. And then another thing is throughout this training, throughout this series, we've talked a lot about our concern about this process, this unwinding process. And the folks that we kind of talked a lot about are individuals who might have moved and may not get their renewal packet to their address, may not be aware that they're up for a redetermination. Today, we're going to talk a little bit more about, focus more about individuals who may need just some extra help to get through that process. So yes, today's agenda, we're going to talk about, we're just going to do a recap about unwinding in the timeline. We're going to talk about what is reasonable accommodation. We're going to talk about TennCare and tools to support individuals with disabilities to complete this process. And then we'll conclude with a question and answer session. All right, so let's do a little recap of the timeline. So on January 31st, 2020, the U.S. Department of Health and Human Services, HHS, issued a public health emergency, PHE, due to, as we all are very aware, COVID-19. And March 2020, Congress then passed the Families First Coronavirus Response Act, FFCRA, which provided an increase in Medicaid funding to states that met certain requirements. And the requirement that we were particularly focused on was the requirement to maintain continuous coverage for most Medicaid enrollees during the PHE. So this meant that individuals who were on the program were basically required, this federal government required that states keep those folks covered during this public health emergency. So of course that makes a lot of sense because we were in a health crisis. The last thing that folks should be worrying about is their health insurance coverage. So, you know, years passed, and then in December 29th, 2022, Congress passed the Consolidated Appropriations Act, and this separated the continuous enrollment requirement from the PHE timeline. So in this act, they also explicitly stated that the continuous enrollment requirement was going to end on March 31st, 2023. So states started having to, you know, make sure that they had a good plan in place because this is going to be a big change. You know, there's been 3 years essentially of individuals not having to go through the normal process of maintaining their TennCare coverage. And this was national, so all states had to, you know, come up with their plan to unwind to get kind of back to normal. And so unwinding is this term that folks are using to, you know, this is how we're getting back to the normal redetermination process. Because normally what happens is a Medicaid program like TennCare will check in on an individual's basically eligibility. They'll send a list of questions for individuals who they're not able to already know based on data that they're able to collect that they're eligible. So they'll send a list of questions to the individual or the family. You'll fill it out, send it back to TennCare, and now you have the option to do it online in your TennCare Connect portal. And you also have the option to do it over the phone. And they'll review your questions, may ask you for some verifications. And if you meet the eligibility requirements, because again, Tennessee is a non-expansion state, so you have to fit into very specific categories and meet the requirements of those categories to be able to have your health insurance. And so normally that happens annually, but during the pandemic that was paused so you could have that continuous enrollment, meet that continuous enrollment requirement. But now we're getting back to normal basically. And so on February 15th, 2023, Tennessee submitted its unwinding plan to CMS. And then in March, Tennessee began its unwinding related renewal process. So it started kind of implementing its plan. March 31st, 2023, that was the big date. That was the end to the continuous enrollment provision. And so our organization started seeing folks come into our office in April with, hey, I got a redetermination packet. Can you help me fill this out? Can you make sure that I'm filling it out correctly? So beginning in this time, Tennessee is now able to terminate individuals found ineligible. Now they have to go through the complete process, right? So they can't just terminate you and you lose coverage. They send you a notice and they basically say the reason why they're terminating you and your end date. And you always have the opportunity to appeal if you disagree that their reasons are correct. So now, we're now starting to see terminations because people are found ineligible for the program. But the date that we're also very concerned about is beginning in June of 2023. Tennessee will now be able to terminate individuals because of procedural reasons. So this means folks who are eligible, but may not have completed the paperwork attached, filled out the questions. Maybe they didn't see the notice and they didn't realize they were supposed to do these things. If they didn't respond on time, TennCare is now, beginning in June, will now then be able to terminate those individuals, even if they're eligible. So we're very concerned about that because we definitely know that there will be some individuals who won't be able to navigate the process, may have missed some, paperwork that they need to complete for whatever reason, and even though they are eligible. So that's part of why we're here today, to kind of collaborate, think through this creatively. How can we best support individuals get through this process? So today, before we talk more about reasonable accommodation specifically, I want to flag some of the disability-related categories for TennCare. So these are individuals who may fulfill some of the disability-related ways that someone can get TennCare in our state. And one of the things that we know from our experience of working with individuals is TennCare is not always able to screen these individuals well. So folks who are kind of fitting in these categories may not actually, and apply for TennCare kind of hoping to, fulfill one of these categories, may not actually get enrolled, or folks who are on TennCare and then maybe transition to one of these categories. TennCare may not recognize it and may send a termination notice. And so we want to make sure that you all are aware, and we have other training specifically about these categories, and we can kind of go into that. But of course, you're always welcome to refer individuals to us because we have more experience kind of screening these individuals and assisting them with an appeal or something like that. And so this is just an aspect of kind of the disability related categories and the reasonable accommodation conversation that we're going to have today. And one of the things that I talked about earlier as a tool that our organization uses to address some of these issues is because we were recognizing that individuals were not being screened for these categories well. This is an aspect of one of our impact litigation cases. It's a class action lawsuit in Middle District of Tennessee, AMC versus Smith, if you all are interested. And one part of that lawsuit is specifically talking about the inadequacy of screening for these categories. And, these are individuals who are most in need of this health insurance coverage. And so this is something that absolutely needs to be addressed and hopefully will be resolved in a way that benefits Tennesseans. Another thing I want to mention is, we've talked a lot about TennCare and cover kids throughout this series, but the Medicare Savings Program is also part of this redetermination process. And so individuals who have Medicare but need help with those costs and they fulfill the income eligibility requirements for an MSP, may have to complete this renewal packet. And we've seen already some situations where folks who historically had an MSP are being terminated for mistakes that are happening in terms of the reviewing of their documents, as well as there's a very kind of difficult conversation of this buy-in, which is where the state automatically covers some of the Medicare costs. And an MSP is, very important for our older adults and folks with disabilities who have Medicare, because paying for those Medicare costs can be quite a significant financial burden for some individuals. And that's why these MSPs exist. So I just want to make sure that that's in the back of your all's mind when we're talking about the redetermination process and the unwinding. And the link here too is just a link to TennCare's policy manual around these categories. So if you want to look into them and be more familiar with them, please feel free. But again, TJC is here to help if you want to refer individuals to us as well. So now let's get into reasonable accommodation. So please feel free in the chat to kind of let us know what you understand reasonable accommodation examples to be. And as a hint, you may know it through maybe a housing or employment context. So please feel free to just share in the chat some reasonable accommodation examples that you're familiar with. All right, so it looks like folks are shy. Oh, okay. Yeah, we got some examples. Great. Thank you. So we got some examples. Thank you so much. I appreciate that. So I'll just get right into it because it seems like y'all are shy. So reasonable accommodation are basically modifications to, or you can say like extra help in the context of getting through the Medicaid program and interacting with the Medicaid program to be able to access it. And so you shouldn't be denied the access of the program because of your disability or something like that. So we're going to kind of go back and talk about some of the laws that are the reasons why Medicaid programs need to consider providing reasonable accommodations or must provide reasonable accommodations. And so first we'll start with Title II, Americans with Disability Act, states no qualified individual with a disability shall, by reason of such disability, be excluded from participation in or be denied the benefits of services, programs, or activities of a public entity or be subjected to discrimination by such entity. And so the implementing regulations, so that's the Code of Federal Regulations, which helps give more understanding on how to implement these laws, tells us that this includes, one, not making it harder for someone with a disability to participate in the TennCare program, but also the program must provide reasonable modifications to avoid discrimination, with the caveat of unless it would fundamentally alter the program itself. And Section 504 of the Rehabilitation Act reiterates this: no otherwise qualified individual with a disability shall, solely by reason of his or her disability, be excluded from the participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. And so that includes Medicaid programs, which is TennCare and Tennessee. In Section 1557 of the Affordable Care Act, I'm going to paraphrase: any individual shall not, on the grounds prohibited under the Civil Rights Act, the Education Amendments, Age Discrimination Act, Rehabilitation Act, be excluded from participation in, be denied benefits of, or be subjected to discrimination under any health program or activity, any part of which is receiving federal financial assistance. Again, Medicaid program, TennCare. So what does this all mean? Well, it means that these public entities and those receiving these HHS funding must provide services, programs, and activities in the most integrated setting, appropriate to the needs of qualified individuals with disabilities. They must make reasonable modifications to avoid discrimination. They must ensure their programs, activities, and services are accessible to and readily usable by individuals with disabilities. And they must provide auxiliary aids at no additional cost to individuals with disabilities. And so this includes, and is not limited to, and of course, when we have conversations about individuals with disabilities, it's very specific to the person. What do they need to be able to understand how to get through the process, or to be able to access the process? So auxiliary aids can include things like an interpreter through video or on-site, in-person assistance, assistive listening devices, brailled material, large print material. These are all examples of reasonable accommodation to be able to access the program. And so now let's talk about how TennCare communicates this to individuals on the program. If you ever have seen a TennCare notice or looked at materials on the website, essentially what they say is, hey, do you need help because you have a disability or a health problem or a learning disability? Call us at, and they provide their general TennCare Connect number. And so this is the number where you go to maybe send in an application, update information, report a birth. So a lot of these folks are just kind of, call representatives who may not necessarily be familiar with you or your needs. And so we've seen that this can actually be quite a barrier for folks to explain what they need, especially if you have a disability and are not able to easily explain your need. It's also confusing how to explain what you're needing, because you may not exactly know what's happening in your case. You may not know what is being asked of you. And so having to kind of navigate that, and then also kind of voice some way that triggers to the representative at TennCare, the caller representative at TennCare, that you need some kind of reasonable accommodation is extremely difficult for some of our clients. And so one thing to note is that you don't need like magic words. You don't need to say, I need a reasonable accommodation or something like that. The representative is supposed to be able to identify based on, a conversation that you've had, maybe something like, I'm hard of hearing, I can't hear what you're saying. They're supposed to be able to identify, hey, this person may need some reasonable accommodation to get through this process. The other thing is that we're seeing as kind of a barrier is TennCare doesn't really have a way of tracking on your case that you have a disability that may not improve, or that may worsen. And so another barrier is that it seems that each time you may need some help, it's a new process. So there's not something that kind of is tagged on your case. Visually impaired needs large print. That won't stay with your case. And so each time some update happens or something new happens or they terminate you incorrectly, you have to kind of go through the process of figuring things out without that reasonable accommodation that you may have already asked for years back. And so that's another barrier that we're seeing with our clients. And then this is kind of the notice that they have in most, the pieces of paper that they have in most of their notices, where they're kind of explaining call TennCare Connect. They do have some other numbers, which I think we've seen as kind of a hit or a miss in terms of assisting with navigating. So they do have the Tennessee Relay Services. But again, here, this is kind of putting a lot of burden on the individual. So they have to call this number and then they have to communicate to that person, hey, call TennCare Connect. So depending on the individual's disability, this can be very burdensome to try and navigate and advocate for yourself. Another contact that they mention here is the Division of TennCare Office of Civil Rights Compliance. And so this is also shown on their website as the office that kind of troubleshoots and helps folks who have a disability navigate. We know that this office is a very small office, staffed by just one person. And so the ability for that person to navigate all of the individuals throughout Tennessee who may be having difficulty navigating the program can be pretty difficult. And it's also it's not very clear who to contact, like who this person is, and that this person is the one to kind of get to eventually to help navigate the program. And we've also kind of seen it's a hit or miss in terms of the reasonable accommodation that's provided. I think a lot of what's provided maybe, we read the notices out to you. We try to explain what the notice means, but beyond that, it's not very robust in terms of navigating this process. TennCare Connect, if you call the representatives there too, I think are supposed to be able to identify and connect you eventually with someone at the Office of Civil Rights Compliance, but it's, again, a hit or a miss in terms of who you're talking to. Can they recognize that this person needs some extra help to get through the process? And so, in our opinion, this is not an adequate process, and we would argue that under the laws, this is not an adequate process. So we are addressing that in some of our litigation, and please feel free to reach out to us if you have more questions or if you have any examples where you know of someone who's trying to navigate the process, needing reasonable accommodation, just kind of not being able to connect with the person that they need to connect with. Please feel free to reach out to us, and we will see if we can help. And so this brings us to some tools that you, as a community member or an advocate for a loved one or an organization, that can implement to support these individuals. Because as we said, we don't think that TennCare kind of meets its obligation in terms of providing reasonable accommodation. And so we need some workarounds to make sure that we can get through this process together, and folks who have a disability and most are in need of this coverage, make sure that they can get through this process. So the first recommendation that we have is to update your information everywhere. So if you're on TennCare, if you receive Social Security, your managed care organization, if you're on the SNAP program with the IRS, make sure that your address is up to date. Any information that they need on file for you is up to date, because we do know that TennCare will grab that data. And if they're able to, get that data and say, hey, this person is actually eligible, they should go through this, what they call ex parte review, and just re-enroll that person. So it's unless they need additional verifications that they might, request that from the individual. We also know that TennCare might kind of update their own information with whatever the data is with these other agencies. And so if they have an outdated address or something like that, that can kind of bump out something that you updated with TennCare yourself. So it's good to just make sure everything is updated. And specifically folks with Social Security, so folks who have SSI or kind of an SSI-like category, something that's associated with their Social Security, is TennCare will really heavily rely on the Social Security data. So that's an agency that you definitely want to make sure you have up-to-date information with. Another thing to note with Social Security is that some of the, I lost that thought. I'm so sorry. Hopefully I can come back to it. Another recommendation that we have is just make sure you kind of voice wherever you can. If you're helping an individual or you yourself need some assistance, make sure you're voicing it wherever you can. So if you're completing things online, they should have options where you can add additional comments. Make sure you add something, I'm hard of hearing, please provide some assistance if calling or something like that. Or you can call TennCare Connect and also voice there. You can maybe say something like, if verifications are needed, we'll need additional time because of, I have a physical disability or something like that. So just kind of voice the things you need as much as possible. Now, we're not sure if that will always result in actually providing you help, which is why we are hoping that you connect with us so we can see that as an example and advocate for you on your behalf. But in some cases, it may actually get you to a person or an individual at TennCare to help you get through the process and provide that reasonable accommodation. The other thing that we always recommend, of course, as a law office, is to file an eligibility appeal. So if you get a termination and it says something, like maybe one example is, you didn't send in the paperwork on time, but, you tried to do it, but you were not able to kind of get through the process because your disability impaired you from being able to complete the process in a timely manner. File an eligibility appeal and say, hey, I needed reasonable accommodation. I called you and you didn't provide assistance. Anything to kind of make sure that you're communicating and advocating for yourself is a tool that we recommend using. And, for folks who maybe have gotten a notice, but didn't understand the notice, and you're assisting that person, file an eligibility appeal. It could be that there's just not clear communication that's happening. And so we just want to make sure that you have the tools at your disposal to advocate. And of course, if you need assistance with an appeal, please feel free to reach out to our organization. We help with appeals all the time. And also for folks who kind of think that they might be in a disability related category, you file an eligibility appeal. It can be confusing to know if you actually are qualifying for that category of coverage, but it's best to advocate for yourself on the front end and then try to get some more information to see if how you can argue it. And that's our organization's role too. So if you think, well, hey, I've been on TennCare for years and years and years. All of a sudden I'm getting a termination. I have no idea why. And, I've received Social Security for all this time. My income hasn't changed. File that eligibility appeal, and then you can reach out to our organization and we can do a screening to make sure that we have a legal argument at the appeal and assist you. We've seen a lot of cases, especially with the disabled adult child category, where it just, something kind of changed, but, you were always communicated that you were going to maintain your TennCare. And then you get terminated, and it's a very harrowing experience for folks. And so they'll connect with TJC eventually. I mean, we don't get connected with everybody who probably faces this problem, but we're able to kind of navigate and help them. The other tool that we recommend, no, we don't agree that the bulk of the responsibility of helping to navigate the process should fall on loved ones or friends who are assisting enrollees on TennCare. But this is a tool that's available, but it's basically adding an authorized representative on your case. So you would be able to, if you're already on TennCare, you can do this in your TennCare Connect portal or over the phone, and you're basically reporting a change, asking that an assisting person be added to your case. We, as our organization, uses this as a tool to become an authorized representative on cases that we're helping with, so that we can get copies of notices, especially if they're in an appeal. But this is a tool that should be utilized, especially for folks who may not have capacity or something like that, have an intellectual disability and just will not be able to comprehend what the notices are trying to communicate. But we don't want to say, this is the only way that folks should, who need help, should be getting help. TennCare should also have some responsibility and make sure that folks are getting through the process. And so, as I said, you can report online. This is also available on the online application as well as the paper application. And you can see that on the paper application, it kind of lets you know, and then on the online application, it lets you know some of the authority that you'll be granted if you get added as an authorized representative. One thing that we've noticed is folks who have a power of attorney or conservatorship, even if you've sent TennCare this paperwork before, the TennCare representative that you may call, if you call the main line, may not be able to find that in the records or know of those records. And so they may ask like a funky question like, we won't be able to talk to you unless we get permission from the individual. Meanwhile, the individual has a significant intellectual disability and would not be able to, like with capacity, give permission like that, but there is an existing conservatorship. So that can be quite a barrier for folks because, we've already sent you this paperwork. It's a lot of steps and red tape to have to send you this paperwork again. And I don't want to keep sending this, confidential legal document out to you. And so this is just a barrier that we're seeing with our clients, or partners are letting us know that this is happening. And so in those cases, we do recommend trying to just kind of hop on the TennCare Connect portal, make sure that you're an authorized rep or assisting person listed on the case, and that you're getting copies of notices. One thing also to note is if you're a provider and you express somewhere in the application or in the person's case that you're an authorized rep, we have seen cases where the provider is no longer working with that individual, but they're still getting notices. So you just want to be mindful of making sure that TennCare has updated information in terms of where to send paperwork to the individual, especially if you're no longer working with that individual as a provider. So to conclude, if you ever want to refer someone to us, please visit our contact us page and fill out a case inquiry form. You can, fill out the information on behalf of the individual. I mean, of course, please communicate to the individual that will be reaching out. Or you can fill out your own information if you are assisting somebody, and we will reach out to you and get more information. You can also, please feel free to reach out to our team directly on questions and maybe collaborate further. We work directly with some clinics like Neighborhood Health. So if you're interested in some kind of relationship like that, please feel free to reach out to us. Diana Gallagher is our casework supervisor, so you can directly reach out to her if you have any questions about a specific case that you're seeing, or you can reach out to Shayna Watkins, who's our outreach coordinator, and she does a lot to make sure that all organizations that kind of interact with TJC and are interested in healthcare access are on the same page about how to strategize in terms of supporting individuals, and also just some other ways that we can improve access to these programs. And of course, you can reach out to me if you have any questions, especially if you're seeing those kinds of cases that we're talking about where people are really having difficulty navigating the process because they need that reasonable accommodation. But TennCare is maybe just not noticing, or they're not actually addressing the person's request, even if it's a very explicit request. And so please feel free to reach out to me. Again, if you're seeing individuals who have a disability but are not being screened properly for disability-related categories, again, that's something that we really want to know about and help with. So please feel free to reach out to us. Excuse me. And we know that, and we would also just love to brainstorm with you all about developing initiatives to reach and assist your clients or constituents. And we know from background experience that individuals with mental health or learning disabilities are likely going to need in-person one-on-one help from a trusted and knowledgeable assister. In the past, our organization knows that there were a lot of behavioral health providers that were actively involved in helping clients through the TennCare renewal process. So if that's something that you're kind of hoping to have in this redetermination unwinding process and would like our support, please feel free to reach out. And another thing to kind of note is that in-person help can be really crucial for some individuals. And we know that the agency, that TennCare doesn't really have a process for that. Sometimes they refer to DHS, the Department of Human Services, or AAAD as agencies that can provide in-person help, but actually getting help from those agencies for the renewal process can either be, you don't actually connect with an individual who knows how to help you with this process, or the agency doesn't actually have any training to provide in-person help with that. So that's just something to note. And hopefully us together, community members, loved ones, organizations can help folks who are having difficulty. Meanwhile, until we can, make sure that TennCare is addressing their responsibility to provide this reasonable accommodation again through the process. So with that, I know that was a lot of information. I'm sure I was speaking very quickly, rambling here and there, but hopefully you all understand that we're here as a resource and we really want to help. But if you have any questions, please feel free to put in the Q&A. Thomas has let me know some questions, so I'm going to go ahead with that. So what about homeless individuals? So yes, this is a concern for us in terms of being able to maintain coverage. Our organization tends to try and connect with other organizations that might provide a safe haven for folks without housing, and may be able to serve as an address, so maybe a temporary address for that individual. In those situations, we also recommend thinking about TennCare Connect online portal. I know that depending on where you are, having access to the internet or computer can be difficult. But if you're, maybe like based in Nashville, and you can go to the library or something like that, the TennCare Connect online portal is an option to be able to see your status, understand what's needed from you. And if you need to provide more information, you can go to the Department of Human Services to provide the additional verifications that might be asked of you. Also, if you have a smartphone, that might be a good option, because you'll be able to like take pictures of things and upload it on the app, the TennCare Connect app. And hopefully that's a way that you can maintain coverage. But yes, that is a very big barrier for folks who don't have housing. And so that's something that if we can think creatively ways to support, we'd love to hear, and we'd love to join in those conversations. Another question is, any new update on how the ECF Choices program will be evaluated to continue coverage? So I'm not 100% sure in terms of what that means if someone's like filling out the renewal packet. There are questions that ask about whether you're on the ECF Choices program or need assistance from the ECF Choices program. So we definitely recommend to keep flagging anywhere that you are, like, hey, I'm on this program, because, honestly, we have seen situations where there was some kind of misunderstanding of what the question was asking, and then TennCare kind of misunderstood the communication and began a termination process, even though the person was on ECF Choices. I hope that answered your question. I'm not sure if I understood your question well. How does this affect folks who are QMB? So folks who have an MSP, which includes QMB, another one that people might be familiar is SLMB, another one is QI, another is QWDI, and those are all MSPs. And so you will go through a redetermination process sometime this year. And so you will also get, that packet of questions. You have to fill it out, send it in. You can also do it on the TennCare Connect online portal. Again, if TennCare has all of the information that they need, maybe you've updated information with SNAP or with Social Security, and they don't need to verify anything with you, they're supposed to kind of within their means be able to do an ex parte review, which is they kind of auto enroll you because they have all the information they need. But that's not going to be applicable to most folks. So most folks will get that packet. And then what is pickle pass along? That's a really good question. So this is a category for individuals who used to receive SSI in the past, but now receive a Social Security benefit. And depending on so that could be like retirement or something like that. And so depending on the timeline, and there's a calculation involved, it's pretty complicated, and we are folks that can definitely screen for that if needed. TennCare has mechanisms to screen for pickle pass along, but sometimes that can be, mistaken. So this is a category of coverage that we're concerned about. It's very complicated. If you want to look into it, we can provide some more materials to you. But basically, anytime you see someone who used to receive SSI, you may want to flag in your mind, hey, this person might be eligible for TennCare in some way. And they're receiving a Social Security benefit now. Is there a process for members who cannot sign for a representative, but has a caregiver who takes care of their business, but isn't a POA or conservator? So you are supposed to be able to have someone who is an authorized representative that doesn't necessarily need the power of attorney or conservatorship, that can kind of act on your behalf. This is a barrier for some individuals who aren't able to sign, but you can, if they have a ability to give verbal permission, you could call TennCare and say, I want this person to be my authorized representative for all time, and I want them to get copies of my notices. If they don't have capacity, that's a little more complicated, but we do see where, the person is a parent or something like that. TennCare is able to kind of understand that this person is helping the individual on their behalf. So I'm going to check and see if there's any other questions. Do you work with Operation Stand Down? We have done some work with Operation Stand Down in the past. I'm on SSI and it just stopped. Will my TennCare eligibility be revoked? I cannot get information from SSA or TennCare. If you are on SSI, you can't use TennCare Connect. If you're appealing your SSDI, your SSI stops, and they don't share information between the agencies. So this is a really good point. The disability-related categories that kind of really rely on Social Security information can sometimes be a difficulty for members, because Social Security and TennCare each have their own information and they don't communicate very seamlessly on these, on a case. And so that's just a barrier for some folks there. If you have SSI, you're supposed to automatically get TennCare. We have seen situations sometimes in the past where folks who had SSI incorrectly got terminated, and that's actually an aspect of our class action lawsuit, the ANC versus Smith case. But you are supposed to automatically get TennCare. And if you no longer receive SSI, and that's the only way that you can get TennCare, that's the only path to receive TennCare, then eventually you will get a termination notice and TennCare will likely terminate you. If you have an argument, hey, I fit into a different category, or I need, home care services and I fulfill the requirements there, then TennCare is supposed to screen you for all other categories as well before they send that termination. And then I think I answered those. Do you recommend when returning applications by mail that you send the application that someone has to sign for? So this provides evidence that they received the application. Yeah, any way that you can get proof that you've sent in the application is something that we recommend. Of the options, we would probably say mail is not our primary recommendation. The TennCare Connect portal is probably something that's better, and you can take screenshots to show the proof, and they're supposed to kind of have records there. And you can kind of keep track of things that you've submitted to TennCare and get downloads of that. The second option that we recommend would be fax, and then keeping that fax receipt, and then mail. And we do recommend that if you send mail, anything that you can do to make sure that there's some kind of proof that they received it and save that is something that we do recommend. I think that's all of the questions. I think that's all of the questions. We can wait a minute or two if there are any additional questions. But if there's nothing else that you take away from today's presentation, the only thing that I'd ask you to remember that TJC is a resource. If you want to collaborate on any kind of ways to make sure folks are getting through this process, as seamlessly as possible, especially individuals who are most at risk of losing their coverage, such as folks who, have moved and TennCare doesn't have their current address, or have a disability and need reasonable accommodation to get through the process, or just plain need an individual to help them with this process. We're here to provide that help. And we'd also love to work with you to address some of the systemic issues that you might be seeing with the folks that you're working with. Just please feel free to flag that to us, and all of this information will be sent to you, so you'll have our contact information. But again, thank you so much for joining us. I hope that this was very helpful.